Hi everyone, welcome back to our channel Nursing Bars K. Today we will discuss about the most important MCQ for the NORCET and other nursing exam. Let's start. A patient with chronic kidney disease is prescribed sevelamer. The nurse instructs the patient to take this medication. Option A, on an empty stomach 1 hour before meals. Option B, at bedtime with a full glass of water. Option C, with meals. Option D, only when feeling nauseated. The answer is option C. Option C is the correct answer, with meals. Sevelamer is a phosphate binder. It is a phosphate binder. Phosphate binder. Patient with CKD have high serum phosphate, high serum phosphorus. The drugs must be present in the digestive tract at the same time, at the same time with food to bind the phosphorus. In the diet and prevent its absorption into the bloodstream. So the answer will be option C, with the meals. Next, during CPR, the monitor shows ventricular fibrillation. After delivering the first shock and resuming chest compressions, what is the next priority medication to administer? Option A, atropine 1 mg IV. Option B, epinephrine 1 mg IV. Option C, amiodarone 300 mg IV. Option D, adenosine 6 mg IV. The answer is option B, epinephrine 1 mg IV. According to the rules of ACLS protocol for shockable rhythm, ventricular fibrillation, pulseless VT, epinephrine is the first line vasopressor. Administered after the second rhythm check. Amiodarone, and the amiodarone is the anti-arrhythmic typically given after the third shock. After third shock, amiodarone. After third shock. Next, a nurse is assessing a client 2 hours postpartum and notes the fundus is boggy and displaced to the right of the midline. What is the immediate nursing action? Option A, administer oxytocin as ordered. Option B, massage the fundus until the firm. Option C, assist the patient to the bathroom and void. Option D, notify the physician of the patient hemorrhage. The answer is option C, assist the patient to the bathroom to void, because A displaced fundus is a classical sign of sign of urinary bladder distension. A full bladder pushes the uterus up and to the side, preventing it from contracting effectively, which causes the bogginess. Empty the bladders, allow the uterus to return to the midline and firm up. So the answer will be option C. Assist the patient to the bathroom for the void. Next, a patient with myasthenia gravis is being tested for a myasthenic crisis versus cholinergic crisis. After the administration of edrophonium tensolin, the patient's muscles strength improves significantly. This indicates option A, cholinergic crisis, option B, myasthenic crisis, option C, tensolin toxicity, option D, normal recovery. The answer is option B, myasthenia crisis, because the tensolin test used for edrophonium is a short acting and the anticholinergic. If the symptoms improves, it's myasthenia crisis, not enough medication. If the symptoms worse, it's a cholinergic crisis, too much medication. It's too much cholinergic crisis means when the symptoms increase, the weakness, salivation, excessive salivation, it's known about the cholinergic crisis. And tensolin test is edrophonium is a short acting anticholinergic. So the answer will be option B, myasthenia crisis. Next, a mother brings her 2-year-old child to the emergency, stating the child swallowed a coin. The child is coughing but can speak and breathe. What is the nurse's priority? What is the question? Swallowed a coin, the child coughing but can speak and breathe. What is the nurse's priority? Option A, perform the Heimlich maneuver. Option B, encourage the child to cough forcefully. Option C, prepare for an emergency tracheostomy. Option C, obtain an X-ray to locate the foreign body. The answer will be option D, because perform the Heimlich maneuver, this is not the proper treatment for doing the proper treatment for swallowed coin patients. Encourage the child cough and forcefully. Never forcefully do the coughing, because it can stuck to the trachea. It can damage the trachea and sudden death can occur. Prepare for an emergency tracheostomy. Don't do the tracheostomy until and unless you know the exact location of the foreign body, like a coin. The answer will be option D, because at first you have to know the position of the foreign body. After that you can do the next step. So the answer will be option D. Next, which is the preferred site for intramuscular injection in an infant under the 12 months? Option A, deltoid muscles, option B dorsogluteal muscle, option C vastus lateralis muscle, option D ventrogluteal muscle. The answer will be option C vastus lateralis muscle. In infants, the vastus lateralis is the most, it's located in the thigh, is the most developed muscle. The gluteal muscle do not develop. The gluteal muscle do not develop until the child has been walking for some time. The deltoid is too small, the volume of the infant vaccine. So the answer will be vastus lateralis. Ventrogluteal muscle used for the adult, not for the 12 months infant. So the answer will be option C. Next, following a total thyroidectomy, the nurse notes the patient has positive chopsticks and the trousers sign. Which medication should the nurse prepare? Option A potassium chloride, option B calcium gluconate, option C sodium bicarbonate, option D levothyroxine. The answer will be option B calcium gluconate, because during the thyroid surgery parathyroid glands may be here. The parathyroid gland remove accidentally, leading to the hypocalcemia, there is a two signs: facial twistings and the carpal spasm with BP cough. So the answer will be option B. We have to give the calcium gluconate immediately. Next, which IV fluid is considered hypotonic? Option A 0.9% normal saline, option B 5% dextrose in lactate ringers, option C 0.45 sodium chloride 1/2 NS, option D 5% dextrose in 0.9% NS. The answer will be option C 0.45 sodium chloride. Except this, all are the normal, it's a normal, not hypertonic, it's not hypotonic, it's an normal saline. And 5% dextrose. Hypotonic fluids have the lower concentration of the solutes than the plasma, causing fluid to move into the cells. 0.9% solution is an isotonic, and 0.5% dextrose and the 5% dextrose in the NS, both are the hypertonic. So the answer will be option C. Next, the occurrence of a disease in a community is excess of normal expectancy is termed as option A endemic, option B epidemic, option C pandemic, option D sporadic. The answer is option B epidemic, because epidemics mean a sudden increase in cases above what is normally expected in the population. population. It is known as the epidemic. Endemic means, what is meant by endemic? Endemic. What is meant by endemic? Constant presence of disease in a geographic area. Example, malaria in certain part of India. And what is meant by the pandemic? An epidemic that has spread over several countries or continents. So the answer is option B. Next, a patient with cirrhosis is receiving lactulose. The nurse knows the medication is effective if the patient has option A, increased the appetite, option B, reduced abdominal girth, option C, improved mental status and decreased ammonia, option D, absence of nausea. The answer is option C, improved mental status and decreases the ammonia, because in liver failure the liver cannot convert ammonia to urea. High ammonia causes the hepatic encephalopathy. Confusion, it can cause the confusion and coma also. Lactulose works by acidifying the colon while traps the ammonia and excretes in through the diarrhea. Thank you everyone. Please like, share, subscribe our channel. If you want to test paper or any topic wise MCQ, contact this number. You can message in WhatsApp. You will get unlimited time. Only this much price you have to pay. You will get unlimited question access for the lifetime. If you are interested, please contact with this number, only WhatsApp. Thank you everyone.